Hi everyone, this is Kate Warnock, GuideWell's social media manager. We're back here live in the GuideWell Insights Lounge at MediFuture. I'm delighted today to have Dr. Erika Bliss. She is the CEO and a family physician as well at Qliance. Welcome to GuideWell Insights Lounge.
Thanks for having me.
Oh, we're so glad to have you. So, Dr. Bliss, you really have a unique care delivery system in the Qliance model of care. Can you explain a little bit more about what that is for our viewers?
Sure, happy to. So Qliance is a primary care organization, and we set about to really revitalize primary care and reestablish that direct relationship between the doctor and patient, which has really been eroded in this country over the years. Some of the problems with the current system, the fee-for-service insurance billing-based system, is that it drives the wrong incentives for doctors, and it in primary care, which is reimbursed at a relatively low level, it drives a lot of volume instead of value.
Sure.
And this is a common theme that we're talking about in general in healthcare now. So what we endeavored to do was to fix the business model first, so that we could have a stable platform on which to build the right kind of care model. So we eliminated fee-for-service billing and set out to offer a monthly fee, subscription-based primary care service that would allow people to have really unrestricted access to primary care. And so we charge more per month than a typical payer might pay when they load up all their fee-for-service payments over the course of the month. 2 to 3 times what a typical payer is going to pay. But it's still not very much money. I mean, we're talking in the range of $60 to $80 per person per month, roughly.
Right.
So what we offer for that is, like I said, unrestricted access to care. You get a personal physician or nurse practitioner, it's person's choice, who is really your single, main point of contact. You get 30 to 60 minute visits in the office. You get 15-minute scheduled phone visits, not when the doctor decides to call you back, but when it's convenient for you. Email communications, you name it. And then our clinics are open 7 days a week. Extended hours during the week, and then after hours, if you have a health concern, you call the clinic and it routes you to the doctor on call directly. So there's no routing through a nurse triage system or an answering service. We figure that we really turned this back around and said to the patient, you're in charge.
Right.
If you think you have a health need, then by golly, you have a health need, and we're going to address it.
Right.
The interesting thing about it is that people love it, because they get the personal attention they crave. They get a trusting relationship.
60-minute doctor visit, that's unheard of, isn't it?
Yeah.
Right.
I'll tell you that practicing this model now for 7 years, I've practiced in this model longer than I ever practiced in the fee-for-service model. I kind of don't even remember what it felt like before, and now I look back and I think, how did I ever get to know people in 15 minutes?
Right.
I mean, you just can't. It's like any relationship. It takes time to build up trust and get to know people.
Sure.
So what we see in our population is some interesting outcomes. First of all, we have very, very high CAP scores. So the patient experience and satisfaction scores are through the roof. I mean, above 95%, pretty much every category. We get incredible comments on our survey. People say, I love my doctor and I love Qliance. They really bond with us, which is really what we're after. We're trying to create a primary care system where we are the path of least resistance. Because if you think about it in a healthcare system, if someone is going to utilize healthcare, you want them to spend their time in primary care. I mean, that's really the goal.
Absolutely.
None of us really want to spend our time in the advanced care system, because that means you're sick. If you're in primary care, it means things haven't gotten totally out of control yet, maybe, right? So, and when you do have to go into the advanced care system, you want a trusted advisor who's going to walk you through that. So we do that too. We heavily coordinate care when we do referrals and things. So people really like that. The individuals who pay for their own care, and payers and purchasers like employers that we've been working with, larger and larger groups as the years have gone by, are starting to see evidence of dramatic savings. And so what we're seeing is anywhere from 10 to 40% total savings after our fee, depending on the population. So healthier populations, there's not as much of a margin there to carve off. There's not as much waste. Sicker populations, there's a huge amount of waste.
For sure.
So just by making it easy for them to get primary care, makes them less likely to show up at the ER. They're less likely to postpone taking care of things that could land them in the hospital. We are much more able to redirect people so they don't go to the orthopedist for every little thing and end up having surgeries they don't need.
Sure.
Any number of things. So it all makes sense. You would expect to see these things going down if people get more primary care. So it's one of those very simple, kind of elegant solutions, but one that we as a society have not been willing to invest in. So what we have set about to do is to create a scalable model of this. So, we have 6 clinics in the Puget Sound. We have over 40,000 patients now. We grew a lot this year. And our goal is to replicate that throughout the country and take care of every type of population, Medicare, Medicaid. Right now we're doing Medicaid, exchange, employers, some individuals, small and large employers. We want to move into Medicare. We really want to be able to use this model to take care of anybody. It really should work for any one of us.
Sure.
And continue to grow it from there and prove that not only is it better care and makes people happier and they feel good about it, it saves a ton of money and gets us to where we need to be as a healthcare system.
Dr. Bliss, you raise a fascinating point. There's no doubt in my mind that your patients are beyond satisfied with the care that they're receiving, the employers and such. How is it, though, in this time of the supposed shortage of primary care physicians, you're managing to staff a model like this and look to expand it? What's the solution that you have discovered for that?
That's a great question. Workforce is a huge issue. We've spent years as a country devaluing primary care. Well, if you want people to go into a career, it needs to be highly valued in society. So medical students go in with the best of intentions, and I really do believe a lot of them want to do general medicine, primary care, right? But they hear throughout medical school that, you're too smart for that, you should go for the subspecialties. They see very harried, stressed primary care providers, and they say, well, I don't want to do that. And they end up making what ends up being the right personal choice, but it's the wrong choice for our society. But the solution is not to push people into a bad choice. The solution is to fix the choice and make it really desirable. So that's the secondary thing we're trying to accomplish, is not just build a good model, but build it and they will come. So we're trying to build a model that will draw the excitement and interest of pre-med and med students, so they'll pick the primary care specialties. So for right now, we don't find it all that difficult to recruit because we're offering a very different way of practicing. We're offering them an opportunity to connect with people, to help people, to really dig in and solve the tough problems that you don't get a chance to do in fee-for-service primary care. We have found that people are very happy to come and work with us. They have to take care of fewer patients. They get to do a lot more for them. It's a much more satisfying professional life. They work hard. I'm not saying it's an easy lifestyle.
No doubt,
But it's working hard on things that really matter.
It's what drew them into medicine to begin with, I'm sure, to your point. And so the patient satisfaction just feeds over into the provider satisfaction, and you have something that's just a win-win. So with your practice, Dr. Bliss, technology and social media has really changed how consumers interface with everybody, including their primary care physician. How is it that it's impacted the Qliance team of physicians?
It's been really interesting. We've found, I joke around and I say, people say, do you do telemedicine? I said, well, yeah, the telephone.
The first, telemedicine 1.0.
Right. And the funny thing is, in healthcare, we forget that the telephone was the first form of telemedicine. Right. You are allowed, you're able to communicate at a distance, but it's totally underutilized. So that was one of our first changes we made. We started out like a typical office. Patient would call in and say, I want to speak to my doctor, take a message, they'll call you back. Well, we suddenly realized, wait a second, we're calling back when it's convenient for us. But what if that's not convenient for the patient? And when we first designed the Qliance schedule and model and all of that, we thought, let's solve for the hourly wage worker who has very little control over their schedule. Missing an hour or 2 or 3 of work is a very, very costly thing.
Could be devastating,
Driving to the office, parking, all those costs is really, they're going to think twice about it. And we don't want them to think twice. So how do we solve for some of that? Also, they can't necessarily carry their phone around with them like maybe an executive and say, oh, excuse me, I got to take this call. No, I mean, if you're a grocery store worker and you're not on your break, don't you dare pick up your phone. You'll be fired.
That's right.
So we changed it to phone visits, which we could do because we didn't have to worry about getting paid for it. We're already paid. We got paid our monthly fee. So we started scheduling them so the person could call up and say, I want to speak with my doctor. Great, is 2 o'clock okay for you? They'll call you then. What number should they call? So then 2 o'clock I pick up the phone, call the patient, we have a discussion, do whatever we need to do. So we've really kind of ramped up the use of the phone, number one. We use email very heavily. Patients absolutely love it. It's amazing. The more you get to know people, you can do more and more and more remotely. And they send us pictures and documents and all kinds of things, that they want us to review.
Right.
So it makes us more efficient. It makes the patient more efficient. We are now starting to move into video visits and we're looking at other technologies.
Okay.
I think, texting is not HIPAA compliant,
right.
Which is a big problem. We need to get that either
solved. Right.
We need to get that solved somehow. But
right.
there are some interesting technologies out there you can use in the meantime that are sort of a version of texting. We're looking at other kinds of telemedicine that don't necessarily interact with the patient directly, but interact with other specialists. So, for example, we use an online consulting service where we can upload information about a patient and ask a question. The service routes us to an academic specialist who's top in their field. They respond within 12 business hours. And oftentimes that totally diverts a referral, or it improves the referral because we're getting that expert advice.
Absolutely.
Say, I don't need that specialist, I need this one. Or
you've had a virtual consultation and not at the patient's expense.
Exactly.
Right.
And we take that on as an expense because we feel like that's our obligation. We should be providing really good care. And there's certain things you can't answer by looking them up. And you can't just keep calling the same specialists in town and not sending them patients. And we don't send patients very much. So this kind of a service has become very, very important to us.
So clearly you're looking all the time probably for what technology can we do that's going to simply enhance the model that we already have.
Exactly.
And I think that's a big part of what MediFuture is about.
Right.
Are there particular takeaways from the day that you've had here today that you'll bring back to your Qliance team?
Absolutely. One thing that I've really enjoyed about this conference compared to other sort of innovation type conferences that I've been to is that it's a very interesting mix of people. And so you start having some very interesting almost cross-disciplinary discussions.
Right.
And what I think people here are trying to do is solve for the larger system problem. And the thing I'm mostly taking away from this is not necessarily specific solutions, although there are some very interesting options and opportunities here, but it's more sort of what some of the speakers have talked about in terms of reaching across barriers into areas that you wouldn't necessarily think of as natural allies and go 3 steps out and think about, 10 years from now, how should the landscape look? Maybe those people who don't look like my friend right now will be my friend. Right. And maybe we should get started on that relationship now. How can I convince them or help them? And how can they help me to continue that evolution? So it's really got me thinking more about unconventional partners.
And I really, our GuideWell CEO was here this morning, and that was the first thing he said why he came here was because he was looking for unconventional partners.
Right.
As I think really in this age of consumerism, you can't do it alone.
Right.
And you can't do it well without the right people to help take care of the consumer. So I think that you've just done your innovative care delivery is just fascinating, and I wish you every success with it. Just delighted to have you here with us today in the GuideWell Insights Lounge. And thank you for your time. This is Kate Warnock, Social Media Manager. We'll be back with you soon.